Monica, and I'll be your nurse today. And what's your name?
Cameron.
And how old are you, Cameron?
18.
Nice to meet you. Well, today you're in for just an abdominal assessment. I'm going to be doing a lot of touching. It doesn't mean that anything's wrong. I just want to make sure I do a thorough assessment. If at any time you feel any tenderness, just let me know, okay? All right, any questions before I get started? All right, so first we're going to start at inspection. I'm going to inspect at eye level. I'm checking to make sure that your contour and your shape are symmetrical, which it is. I'm looking for the color, which it is appropriate for your race. I'm looking for any scores or striae, which I don't see any. And your umbilicus is nice in midline. And I'm not seeing any visible peristalsis or pulsations, which is good. So next I'm going to start by listening to your bowel sounds. I'm going to be listening to a lot of areas. It doesn't mean that anything's wrong. I'm going to start with the diaphragm, and I'm listening for your bowel sounds. Perfect. Now what I'm going to be doing is listening for vascular sounds. I'm going to be using the bell of my stethoscope, which is the small side. This is your aortic, your renal, your iliac crest, and your femoral. All right, any tenderness noted with that? All right, so now I'm going to do some percussion, which is some tapping. Any tenderness or no, any pain? All right, now I'm going to do some light palpation. Any tenderness or pain? Now I'm going to go a little bit deeper and do some deeper palpation. Any pain or tenderness? All right, I'm going to have you move your arm. Now what I'm going to be doing is checking for any organ swelling. I'm going to be palpating your liver. So how I'm going to do that, I'm going to lift you up, and I'm going to go under your rib cage, and I'm going to have you take a deep breath. Any pain or tenderness? All right, relax. Now I'm going to do the same thing on your left side. The left side is your spleen. So I'm going to lift you up, go under your rib cage, take a deep breath. Any tenderness? All right, perfect. Now what we're going to do is I'm going to check your gallbladder. I'm going to do a few tests to check for that. The first one is going to be the Murphy's test. So I'm going to go under your rib cage. I'm going to have you take a deep breath. All right. Any pain or tenderness? All right. Now this is going to be the McBurney's point. Take a deep breath. Any pain or tenderness? All right. What about when I push back and take it away? All right. The next one is going to be your Bloomberg test. I'm going to have you take a deep breath. Any pain or tenderness? What about when I take it away? All right, great job. So now what we're going to do, that was checking for appendicitis. Here was checking appendicitis. Here was checking for appendicitis. appendicitis, and we were also checking for any rebound pain. Now we're gonna do what we call specialty tests. This is another test to check for appendicitis. I'm gonna have you lift your leg up, and then I'm gonna press. Any pain or tenderness? All right, and your other leg. Any pain or tenderness? All right, that was also checking for appendicitis. Any questions before I move on? All right, I'm gonna have you sit up. Oh, I'm sorry, that was the iliopsoas test. All right, I'm gonna have you turn just a little bit for me. What I'm gonna do now is check for some CVA tenderness, which is checking your kidney. All right. Any tenderness?
No.
Any tenderness?
No.
Okay. One more thing, I forgot something that you can lay back down. I'm also gonna feel for your kidney. Just relax. Any pain or tenderness? All right. Let's see. Any pain or tenderness? All right, I'll help you sit up. And that concludes your abdominal assessment. Today I'm giving a report on an 18-year-old male who came in for an abdominal assessment. We started with inspection at eye level for the contour and shape of the abdomen, which was noted to be flat and symmetrical. There was no masses noted. His color was appropriate for his race. There was no scores or striae noted, and no visible pulsations or peristalsis, and no tenderness noted upon palpation. We then auscultated the bowel sounds in all 4 quadrants. No vascular sounds were present. With the vascular sounds, we checked the aorta, the renal, the iliac crest, and the femoral. We then moved on to general percussion, was performed with resonance and tympany noted. CVA tenderness was negative to tenderness to both light and deep palpation. We performed the specialty test, which was negative for appendicitis. The Murphy's point, the the Murphy sign, the McBurney's point, and the Bloomberg test, as well as the iliopsoas test. There was no swelling, and we were not able to palpate the liver, the spleen, or the kidney, and there was no tenderness noted.